Hola a todos,
Hello, everyone. Good morning. I hope you can see us well. Thank you for joining us in this weekly press briefing of the Pan American Health Organization on the pandemic of COVID-19 in the Americas. My name is Sebastián Oliel from the Communications Department in PAHO, and this session will last about an hour. As every week, we have received your questions by email, and you will also be able to ask questions live and through the chat and on the Q&A button. Please always include your name and medium when you send your questions. We also have simultaneous interpretation to English, French, Portuguese and Spanish, and you can opt for any of these languages by clicking on the interpretation button. Today, Dr. Carissa Etienne, Director of PAHO, will talk about the evolution of the pandemic in the Americas and also about the situation of vaccination against COVID-19 in our region. With Dr. Etienne, we have today Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Department of Health Emergencies of PAHO, and Dr. Sylvain Antigueri, Incident Manager for COVID-19 in PAHO. Now, I would like to invite Dr. Etienne to share her initial remarks. Dr. Etienne, over to you.
And a very good morning to all of you. And my thanks that you've joined us today for this press briefing. Last week, the Americas reported nearly 1.5 million new COVID infections and more than 26,000 COVID-related deaths, more than any other region globally. In North America, Canada is witnessing a rise in COVID infections and deaths. In the United States of America, cases have been declining during the last week. However, deaths have been increasing. During the same period, Mexico has reported a decrease in transmission. While larger Caribbean islands like Puerto Rico, Cuba, and the Dominican Republic are seeing decreasing trends, most small islands of the Caribbean are experiencing just the opposite. Hospitals in St. Lucia are reporting staff and oxygen shortages as hospitalizations continue to rise. And in Bermuda, like in many other countries and territories, burnout among healthcare workers remains a concern as hospitals are overburdened with COVID patients. Most countries in Central and South America, except Belize, are continuing to see infections drop, although COVID deaths are up in Brazil, Ecuador, and Peru. Vaccines, as you know, have the power to save lives and to change the course of the pandemic. So today, I want to offer an update on immunization efforts in the Americas. More than 1 billion COVID-19 vaccine doses have been administered in our region, and 35% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19. But importantly, coverage is not uniform. While Canada, Chile, Uruguay, and Puerto Rico have fully vaccinated over 70% of their populations, 10 countries and territories in our region have yet to reach 20% of their populations. And in Haiti, fewer than 1% of people have been protected thus far. Most countries continue to have limited access to vaccines. So we are encouraged by the announcements made at last week's Global COVID-19 Summit, where world leaders pledged an additional 850 million COVID vaccine doses, and where President Biden announced that the United States itself will donate an additional 500 million vaccines to low and lower middle income countries, bringing the total US donations to over 1.1 billion doses. At that summit, I told participants that overcoming this pandemic rests on having the tools to prevent, detect, and treat COVID-19. and that we must expand global vaccine production by leveraging the expertise and capacity of regions like our own. Meanwhile, vaccine donations remain the fastest way to support countries in our region. PAHO has helped COVAX deliver 50 million doses to our region, including nearly 14 million donated doses. And we have the capacity to quickly scale this support. So we urge countries not to delay their donations as lives hang in the balance today. Indeed, PAHO is doing everything that it can to accelerate vaccinations in our region. Over the next few months, PAHO will work closely with COVAX to deliver tens of millions of doses to our region, many of which are allocated for countries with low vaccine coverage, like Jamaica, Guatemala, and Nicaragua. Our technical and procurement teams have been working closely with these countries to help them prepare health workers and health systems so they can absorb and administer these vaccines quickly. For example, we are on the ground in Haiti, helping the country make the most of the vaccines that it has on hand, and working with the Haitian governments and international partner NGOs to plan for additional allocations of vaccine supply in the coming months. Special attention is also focused on uptake of vaccines in the areas affected by the earthquake. Looking ahead, we must use all possible strategies to access more doses. Our revolving fund is in advanced discussions with vaccine manufacturers to purchase additional COVID vaccines on behalf of our member states to complement bilateral deals, donations, and doses that they are receiving via the COVAX mechanism. We are really happy to share that we have reached an agreement with Sinovac and have begun accepting orders that will be ready for delivery this year. And we are expected to sign new agreements in the coming days to buy vaccines that have the emergency use listing approval from other suppliers for 2021 and 2022. But administering vaccines requires more than just doses. Today, we need more syringes as vaccination campaigns ramp up. PAHO has already secured over 150 million syringes for our member states, and the revolving fund is working to finalize shipments for the rest of 2021 and to consolidate country demand requirements for syringes and safety boxes for 2022. As we address these immediate gaps, PAHO is also working to expand our region's manufacturing capacity to build a more sustainable and dependable supply of vaccines and medical technologies. Latin America and the Caribbean have imported nearly all the medical products that they've used in the COVID response. And today, we're paying the price as we continue to face delays in production. But our region has the capacity and expertise to lessen our dependence on global suppliers. After reviewing more than 30 proposals, an external and independent committee of experts selected 2 projects: the Public Producer Biomanguinhos Institute of Technology on Immunobiologicals at the Oswaldo Cruz Foundation in Brazil, and the private company Synergium Biotech in Argentina, to receive technical support from PAHO and WHO to accelerate the development and production of mRNA vaccines. That is the same technological platform that is used by Pfizer and Moderna to do that in Latin America and the Caribbean. This is a strategic initiative because mRNA technology can also be used to develop other virus vaccines for relevant public health problems in our region, such as Zika, dengue fever, and others. Both of those institutions that were chosen have a long track record of vaccine manufacturing and will build on this legacy to protect people across the region from the threat of COVID and from future health risks. All vaccines that will be produced under this initiative will be available to all countries in Latin America and the Caribbean through PAHO's revolving fund, benefiting the entire region. Of course, there are many steps to making vaccines. So we are also inviting public and private pharmaceutical manufacturers that can develop and produce essential components for the mRNA vaccines to become a part of this regional platform. Applications are open until October 15th, and we encourage suppliers across our region to apply. And finally, we are counting on the support of member states, financing institutions, and others to prioritize investments in our regional supply chains. Because while expanding regional pharmaceutical manufacturing will require significant investment, the cost of inaction is simply too high, and we cannot go it alone. So once again, I urge countries, institutions, and partners across our region to work together so we can overcome this pandemic faster and be stronger and more resilient when the next crisis strikes. Thank you.
Muchas gracias, doctora Etienne. Vamos a
Thank you, Dr. Etienne. Now we are going to start answering the questions that we have received through email and also those questions that we are receiving through the Q&A. Please give your name and medium so that we know who you are. First is from Cassandra Garrison, correspondent from Mexico and Central America from Reuters in English.
Published a story about COVAX plan to overhaul the allocation methodology for vaccines to take into account the proportion of the population that has been vaccinated with shots through separate deals rather than the country's overall population size. Can PAHO confirm if this new methodology will impact the COVAX vaccine allocations for Mexico or any Central American countries? If so, can you elaborate on the changes and/or timings of those allocations? Dr. Barbosa?
Thank you for this question. This is really very important because we are talking about equitable access that PAHO has highlighted in every press conference. Our director is always calling the attention that we need more vaccines for Latin America and the Caribbean countries. COVAX announced 2 weeks ago that there will be a round of allocation in the last quarter of this year, starting in October, that we will use around 120 million doses to the world. These 120 million doses will be allocated to the countries that have less than 10% of coverage. So this will benefit 3 countries in our region, Haiti, Nicaragua, and Jamaica. But COVAX also announced that for November and December, we will have around 600 million doses, and 50% of this 600 million will be allocated for the countries with low coverage rates in the world. So this will also benefit not only these 3 countries, but the other 7 countries, the 10 countries that still don't have at least 20% of the population covered with immunization. 20% is used as a threshold because when we, in every country, the most vulnerable groups, including healthcare workers, the elderly people with some health condition that can be a risk to develop a severe case of COVID-19, it approximately is around 20% of the population. So this is the minimum coverage that you need to achieve to protect the most vulnerable and to save lives. So yes, COVAX announced these 2 different allocation procedures. This is aligned with what PAHO has advocating from the beginning. We do believe that epidemiological data and also the real coverage that we have in each country should be utilized to define the prioritization to deploy the vaccine. So this is good news that the global mechanism COVAX is accepting to use this criteria that will provide more equitable access. Thank you.
Gracias, doctor. Siguiente pregunta, Cintia Torres de Confidencial en Nicaragua.
Thank you, Doctor. Next question is from El Confidencial from Nicaragua. Is there any specific date of the arrival of Sinopharm and other vaccines in the country? And also, is there any way to identify new variants of the COVID-SARS virus? Thank you very much for your question. Well, tomorrow, September 30th, you would be receiving 138,000 doses of Sinopharm, and then the donation of 233,000 doses of Pfizer, which is scheduled for the end of or the middle of October. PAHO is committed to seeking more vaccines for those countries that have lower coverage. Both the director and Dr. Jarbas have emphasized this. We have seen that the demand for vaccination in Nicaragua is significant. And in this sense, we would like to congratulate the people of Nicaragua who are getting vaccinated, and we hope the vaccines will be more available. Nicaragua has made important efforts in preparing for vaccination campaign. The vaccination campaign, the cold chain has been improved. There has been training of health workers, but still there are many challenges. Not only because there's low availability of vaccines, but also because the announcements and the efforts made need to be very transparent with great deal information in order to control the pandemic. And in this sense, the information that we have available regarding the number of cases, the number of deaths, continues to be very stark and low. We renew our request for the population in Nicaragua to receive enough information, and we want to continue to support Nicaragua so that they will increase the number of vaccines they will be receiving. Thank you very much. Thank you, Doctor. I don't know if Dr. Aldeguerri would like to add something regarding the part of the question which had to do with variants in Nicaragua. Yes, of course. As part of technical cooperation, PAHO has sent inputs and reagents which are necessary for screening and detection of variants of concern of the SARS-CoV-2 virus, not only to Nicaragua, but at least also to 23 more countries and territories in the region. Even though at this point in time we do not have information on detection of variants of interest or variants or concern in Nicaragua, we do know that the Public Health Laboratory of the National Center of Reference is making significant efforts to generate the necessary data, critical data, not only for surveillance, but also for the scientific community and regional and globally. On the other hand, it is always important to put these comments in a global context, and thanks to efforts from countries such as Guatemala, Honduras, El Salvador, Belize, and the help from the Gorgas Institute, which is the one of the reference labs of the genomics regional network, it's been possible to prove that there is alpha, gamma, and delta circulating variants in Central America, together with lambda and mu, other variants of interest. I would like to emphasize this collaboration among the countries in the sub-region of Central America. And I would like to emphasize also the importance of maintaining strengthened genomic surveillance in a sustained way so that we can detect in time introduction and dissemination of different variants. And of course, PAHO will continue to work very closely with all countries and territories in this area. Thank you. Thank you, Doctor. We have several questions about travel restrictions. Daniel Collins, Angeles Cruz from La Jornada, Mexico, Irene Carmen from El Clarín, and Bijani Dagovir from Newsroom in Guyana. The question is regarding access restrictions that are being imposed in some countries with vaccines that have been not authorized by those countries. They want to know the opinion of PAHO and how vaccination, whether approved by national authorities or international authorities, does this uh, attack people's rights? And does PAHO recommend vaccination with other vaccines that are approved? Thank you, Dr. Barbosa. Thank you for your questions. There are many doubts regarding the topic of vaccines and the vaccine certificates, etc. These are things that are very interesting to everybody. Let me tell you, starting at the bottom, uh, we do not recommend to take a second vaccine. No, this has there's no medical need for the health of people to take other vaccines. There are no studies guaranteeing that this is a safe procedure, so we do not recommend to vaccinate twice. This is not a recommendation whatsoever. PAHO and WHO uh, have not established any barriers for traveling for people. So this does not provide any additional protection, and it is effectively a barrier for people. In the meeting of our directing council last week, the countries approved a resolution where very clearly we have seen that access to vaccines should not be used as a barrier, because there is a point in time where many people don't have access to vaccines in our region, and they have access only to some vaccines but not to others. And to establish criteria would be a barrier that should be avoided. This is a decision that each country needs to make. Our recommendation is always not to use this as a barrier. Finally, I think that it is always very important to underline the need to broaden access in a situation where there are so many inequalities in access. Any additional request about vaccines can be a barrier that will increase uh, and increase inequity in access by people. So we hope that the countries are able to continue with those recommendations from WHO and PAHO and not have vaccine certificates or the choice of one vaccine over another as if it were a certificate to authorize people to enter countries. Finally, the IHR, the only vaccine that is established in the IHR that can be requested by a country to authorize entry by an international traveler, is the vaccine for yellow fever. So our recommendation is that access should be broadened in all countries. It's better than to impose barriers that are going to make things difficult and are going to separate countries, etc. Thank you.
Thank you very much, Doctor. The next question is from Argentina in Irene cluster, she's saying that there has been a reduction in cases, more than 1,500 a day, and she's asking whether this is an unusual case because Delta is still not prevalent, and whether we think that that Delta will become prevalent. Dr. Aldiguieri. Thank you for that question. Argentina is not an isolated case in Latin America. We see the same behavior in several countries of that region. We think that the drop in the number of cases has to do with a combination of factors. First, the important transmission peaks in Argentina and in other countries in the same subregion during the first part of 2021 also imply the imposition of strict measures, in particular in the geographic areas where there was an increase of transmission, and that has decreased mortality and also decreased large gatherings. And I should mention that testing has not decreased. The average is over 30,000 a day in Argentina, with a positive rate of 2.8%. Therefore, Argentina has a clear snapshot of its situation with lab support. But it is important, highly important, I would say, to take the immunity issues in question. Argentina is increasing its vaccine coverage rapidly, with more than 47% of the population vaccinated based on the data published last week. So far, and given all of the Delta variant has been identified in 52 countries and territories of the Americas. However, its distribution is quite heterogeneous, with prevalence in North America and the Caribbean, but with slower expansion in some of the countries in South America where the Gamma variant continues to be prevalent. It is quite likely that the Delta variant becomes prevalent in more countries in the region. However, it is difficult to explain why, so far, that Delta variant has not had more of an explosive distribution as we have seen in other regions. A hypothesis, and once again, it is a hypothesis, is that the intense previous co-circulation of several variants, including the Gamma variant, have led to cross protection that is preventing strain replacement and strain transmission. I hope I have addressed the question by the colleague from Argentina. Thank you, doctor. The next questions have to do with the boosters by Irene Hartman of Clarín, Argentina, and Stephen Cyrillian from PJD2 Radio in St. Martin. Irene is saying that several countries are indicating the administration of third doses against COVID-19 for immunosuppressed individuals, that is, those who may not have developed good immunity with 2 doses. And she's also saying that so far PAHO and WHO have discouraged third doses so as to give priority to unvaccinated individuals. She's asking about our opinion, and Steven Silgieri is also asking whether the booster shots are necessary right now, taking into account that there are some countries that have started with them and countries in the Caribbean that still have difficulties to vaccinate their citizens. Dr. Barbosa. Thank you so much for the question. This is an important question because clearly we are facing significant inequality worldwide, and there are some countries that are still awaiting the second dose, and other countries are trying to administer the first dose for the most vulnerable groups. Therefore, PAHO has a position, and we support the position of the strategic group of experts on vaccination, SAGE, based on its English acronyms. That group is reviewing all of the evidence in a thorough manner. It is not possible to make a decision of this sort without the necessary evidence to make sure that indeed it is necessary to have a third shot. Second, the vaccines have a different performance. So we cannot say that the data for one vaccine may apply to another vaccine. It is necessary to have data for each of the vaccines. As to protection after 6 or 8 months or 12 months, as to the efficacy of those vaccines in actual life, and also the availability of vaccines, because the quantity remains the same. But if a country makes a decision to apply a third dose, the vaccines that could have been used for the first dose in vulnerable groups will be used for a third dose, and oftentimes lacking the necessary evidence. So the SAGE group is assessing almost on a weekly basis this information, and there are some indications that for some vaccines there is a reduction as time goes by of the antibodies, but this has to be confirmed, and whether it implies a reduction of protection. There are some studies that are also assessing the efficacy for each of the vaccines. There is some information that show that for individuals that have immunosuppressed systems, some vaccines do not offer protection for an extended period of time, but all of this is being assessed to have complete data. Oftentimes, the study needs to be expanded, needs to have further information so that progress can be made with recommendations that are evidence-based. We have no doubt that the main priority today in the region of the Americas, Latin America and the Caribbean, is to attain high level of coverage with vaccination for the vulnerable groups first, and then for all of the groups. That is the first priority. And then we're also going to issue a reminder. The vaccine has two actions: an individual action, but also a collective action. If the individual who gets vaccinated is in a city, in a province, in a state where community transmission is quite high, that person may be at risk for his or her immunological system not to respond properly or to lose protection after a while. But if this person is in a community, in a city, in a state where vaccine coverage is high and also public health measures are implemented, transmission will diminish. Then this person is protected and will continue to be protected, not because he or she is receiving an additional dose, but because the transmission is diminishing at his or her place of residence. So I think that the priority should be attaining high vaccine coverage, and after the studies are reviewed, revised, we will be in a position to issue serious recommendation regarding this. Thank you. Thank you, Doctor. The next question is by Michael Stott, editor of the Financial Times for Latin America, and in English it reads:
Role of the private sector in the health sector in Latin America and the Caribbean. Doctora Etienne?
Thank you, Michael, for this question. The private sector does have an important role to play, for instance, in hosting the platforms that are necessary to generate and manage critical information and in leading innovation. The private sector also produces critical medicines and technologies that have allowed us to make leaps and bounds in health in general. And in COVID-19, they've worked on the vaccines and also other vaccines that are used in routine immunization programs. Of course, those would not be possible without the private sector development. In many of our countries, the private healthcare services complement those that are available in the public sector. and so help to expand access and coverage. This is particularly important with regards to the not-for-profit private sector. Very often, they provide access to the poor, the vulnerable, and the underserved. This was the case before the pandemic, and it is still the case during the pandemic. For example, in the Bahamas, a private-public partnership contributed to increased bed capacity for COVID-19 patients. It adapted and redefined a model of care to respond to the evolution of the pandemic, protecting communities of the family islands, including transfer of patients and provision of necessary supplies. In Chile, at the beginning of the COVID-19 pandemic, a health alert decree mandated the coordination of all critical beds in the country in an integrated network of critical beds under the management of national health authorities. And through collaborative work with different stakeholders and standardized protocols, all critical beds, public or private in the country, formed a single pool that was available and still is available to any patient in any region of Chile. There are also other good examples of collaboration in several countries. And we have also worked closely in partnerships with the NGOs in deployment of emergency medical teams in transport and logistics and in other key areas. Frankly, I see the private sector as a key partner in the future, in the post-pandemic era, in supporting the necessary transformation of health systems based on a primary healthcare approach, and to advance towards universal health, to build resilience, to confront new pandemics and potential disasters with equity as a central pillar.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. The next question is by Henry Cardenas of La Prensa, Panama. He's asking, what is PAHO's assessment of Panama's management of the pandemic? And he's also asking whether PAHO's analysis reflect the reason why the third wave of the COVID-19 pandemic has not been that strong in Panama in spite of the Delta variant, as in other countries that are already having fourth and fifth waves. Dr. Aldiguieri, thank you very much for this question from Panama. First of all, it is always important to recall that from the beginning of the pandemic, we have had a mosaic of epidemiological profiles in Central America, in different regions, but also subnationally. There are important differences in the behavior subnationally. In the case of Panama, I would like to highlight several factors that may have contributed to a lesser impact of the pandemic in Panama. 5.4 million vaccines have been administered, and that covers more than half of the population with 2 doses, 55%, based on data provided by the Ministry of Health. So that is the first comment, the effect of vaccination. I would also like to underscore the development of a very solid lab surveillance network that allowed for a rapid characterization with more than 10,000 tests a day. And this has enhanced the capacity to trace contacts. And genomic surveillance of the SARS-CoV-2 was established from the outset with the support of the Orgaz Institute, that is one of the 6 reference labs in the Americas. I should also mention that Panama also implemented mandatory protective measures. I'm talking about wearing masks and distancing, etc. They do not let their guard down, as in most of our region. And with the recent opening of some of the measures, it could be that this situation changes, in particular among pools of individuals who are unvaccinated. I hope I have addressed the question by the journalist from Panama.
Muchas gracias, doctor.
Thank you. Thank you very
Unas
much, doctor. We have some questions regarding Venezuela. Nicole Japur from Bloomberg is asking, contrary to other countries in the region, the number of daily transmissions in Venezuela doesn't seem to decrease. Could we also refer to the reasons whether this is related to the relative slow deployment of vaccines in the country and whether the Delta variant has anything to do with this? And also Sandy Martinez from Transparencia Venezuela is asking whether we have details about the Sinovac vaccines that reached Venezuela in September and whether we know how many individuals have received this vaccine. Dr. Ugarte. Thank you, Sebastian. Thank you for those questions. As in many other countries, there are several factors that impact on the increase of transmission. In the case of Venezuela, several factors seem to be taking place. In the first place, the decrease in the implementation of the physical distancing measures and also the low availability of vaccines, the low percentage of the population that has protective coverage, and also the emergence of variants, even though based on official data by ERI, with a very low percentage of the samples are Delta variants. So we could say that as the coverage of vaccination in Venezuela increases protection, it is very important to continue to implement the measures that encompass physical distancing, among others. This is a call on the population because this is the only way that we can protect ourselves, not only against COVID-19, but against any strain, even though there is some capacity. They are not at full capacity yet, but we hope that with the implementation of these national measures, we can maintain this because this will certainly contribute to reducing the number of deaths. The curves show stability in Venezuela or a mild trend, upward trend in comparison to other countries, but the numbers are significantly lower as compared to the ones reported from other countries. In connection with the vaccine that recently arrived in Venezuela, the vaccines have been provided through the immunization program, and we are currently waiting for the official information from the government regarding the administration. And they also have other modalities with other vaccines that they are administering. So soon we will be able to share the information that the organization will be receiving, but in the meantime, we are coordinating responses so as to reduce the number of cases and deaths. Thank you. Thank you, doctor. We have several questions connected to technology transfer and vaccine production in our region. Manuel Lino Gonzalez from Mexico is asking whether the institutions that have been selected in Argentina and Brazil to receive technology transfer of the mRNA vaccine were the only institutions that actually comply with the requirements, and whether there was a limit in the number of centers that could have technology transferred. And we also have a question from Manuel Ramirez Coronel from El Economista in Mexico City, and he's asking, what is PAHO's opinion as to how to best align local efforts to produce COVID vaccines, bearing in mind ECLAC and PAHO's proposals and other bodies, and whether PAHO is also supporting ECLA's attempt or proposal to relax intellectual property provisionally to speed up production of vaccines. Thank you very much for the question. This is Dr. Barbosa. Let me clarify that when we launched the consultation for the surveys, for the proposals, we had 30 proposals regionally. There was no limit to the number of proposals, but we had some criteria that an external and independent committee of experts had to analyze. When they analyzed the proposal had to be feasible. I think that this is a very important proposal, and the proposal had to be feasible to be supported in the country that was presenting the proposal. And all of the products resulting from this initiative had to benefit all of the countries in the Americas and the Caribbean. Within PAHO, we are not working just to give capacity to one country to produce for its own population. We know that during the pandemic, there is a large interest from the countries, and we need to take advantage of that interest so as to produce vaccines, but with feasible proposals that may change the situation in the region. That's the reason why the first step of this regional platform that was launched by PAHO was exactly to use that technology that, as our director indicated, is new technology with mRNA that may be used for other diseases that we have in the region. So we chose the best two projects that were the most feasible ones. One is a public project with the Fiocruz institution in Brazil that focused on an mRNA vaccine. That is to say, they have their own technology to produce the vaccine. And we are going to provide, together with WHO support, technical cooperation, to be able to have a faster process to conclude development of that vaccine. And the private consortium from Argentina, Biotech, Max Science, and Synergia, are very strong producers with strong capability that will be making an investment to increase their capacity. That may also need some technology transfer, and we are working with our colleagues in Geneva to facilitate that process. I am also saying that we are trying to strengthen the capacity in other countries that may have producers for the components of those vaccines. So as our director mentioned at the outset, we do have an open call for biotechnology companies from several countries in the region to participate with their cooperation. The other proposal is that PAHO is also interacting with all of the actors in the region, and during our directing council, when we announced the projects, we invited the IDB, for example, to make an announcement about its availability to offer financing to these projects in the region so as to increase the autonomy of the countries in the region and also to produce more medical supplies. ECLAC has also been part of this call, and we also follow a mandate that has been approved by PAHO's member countries. And during the last week at the Directing Council, the countries approved a very important document to request PAHO to strengthen its leadership role, coordination role, so that the Latin American and Caribbean countries may have greater capability for production. Clearly, we support this because this is part of what we have been doing at WHO and PAHO. That is to say, the countries need to resort to the flexibilities that are already provided for under the Doha IP agreements to use those flexibilities for public health and purposes. So PAHO supports this because there are mandates in the region for that. But we think that at this point in time, when for the most complex products such as mRNA vaccines, for example, it is necessary to have much more than just to obtain the license for production. The license for production is important. That may be very important, but it is also important to strengthen the production capability in the region. If we do not have capability in the region from the producers themselves, from the holders of the patents, we might still be undergoing a difficult situation because we do not have the capability to produce the vaccine. So we need to coordinate productive plants that have good manufacturing practices. We need to have the capability to produce the vaccine. So we need to be able to make this change. And we are there to support the countries throughout all of these aspects that are equally important to continue to have production in Latin America and the Caribbean. Thank you. Thank you very much, Doctor. We still have several questions. The next question is by Noreen Joseph, an editor of Observer Media in Antigua and Barbuda, and in English.
Bermuda has seen a sharp increase in the number of COVID-19 related deaths, with about 30 people passing in September alone so far. Has PAHO engaged with health officials here on the issue? And what advice does the organization have in managing this concerning issue? Dr. Aldighieri?
Yes, thank you for this question regarding the Eastern Caribbean. I'd like to mention the situation update that was published a couple of days ago by our Caribbean team, and I will expand my comments to the whole Eastern Caribbean region. In most of the Eastern Caribbean countries, we are observing a situation of community transmission with limited additional capacity to respond, and a risk of health services becoming overwhelmed in a context of a predominant Delta variant circulation. Nearly 8,000 confirmed new COVID-19 cases have been reported over the last 3 weeks of September, with a 52% increase compared to the month of August. These are data from Barbados, Antigua and Barbuda, Dominica, Grenada, St. Lucia, St. Kitts and Nevis, St. Vincent and the Grenadines. This increase of cases is largely noted in persons who are not vaccinated for COVID-19. In the last week, the increase in number of cases is led by St. Vincent and the Grenadines, St. Lucia, and Antigua and Barbuda. And the hospitalization rate increased significantly in most of the Eastern Caribbean countries. In this context, a larger combination of measures needs to be put in place to limit the transmission, manage the cases, and ensure the control of the epidemic. A particular focus should be on prevention and early detection of potential super spreading events. And I'd like to stress the recommendations of Pan American Health Organization that individuals are encouraged to accept COVID-19 vaccination when offered and strictly practice the preventive measures. And I'd like to ensure the countries and our partners in the Caribbean that the Pan American Health Organization continues to provide test kits and laboratory supplies, oxygen concentrators, in addition of the deployment of emergency medical teams that have been deployed at the moment to assist a couple of countries in all aspects of the response. Thank you.
Gracias, doctor. Siguientes preguntas en el QIA, en el chat. Gisela Salomón de
The
AT.
next questions from Gisela Salomon and Daniel Polite from the New York Times. They say that Dr. Etienne mentioned in her initial remarks that there has been an agreement signed with Sinovac, and could we have more details? How many vaccines, since when, and will the countries pay to PAHO for these vaccines, Dr. Barbosa? Thank you very much for your questions. As our director announced, we are working in all the areas where it's possible to work to broaden access by member states to the vaccine. So we're working with COVAX to accelerate processes, and we're working to facilitate donations, but also we established the possibility of having direct acquisition or purchase of vaccines. It's a purchase, it's no donation. So countries that wish to do so can use this new option to buy through the revolving fund. The Inter-American Development Bank is offering loans to some countries so that they can make these purchases, but these are direct purchases by the country to the revolving fund. All countries interested can have access. So all countries in the region can have access to this. We have had requests from about 24 countries in the region, some for vaccines for this year, some for vaccines for 2022. We are negotiating with all manufacturers who have the EUL from WHO, because the revolving fund can only purchase vaccines from manufacturers that have received their EUL. We have been able to sign an agreement, this was last week, with Sinovac, who are offering 8.5 million doses for this year, and 80 million doses for 2022. So we are also negotiating and still and in advanced levels of negotiation with another two manufacturers who have also offered their supplies for the last quarter of 2021 and for the year 2022. So this is still open, and it's open for all for all countries who want to participate. And we have signed new agreements, and in others we are in the final phase of concluding those arrangements. Thank you, Doctor. And now we are coming to the end of today's session for Dr. Etienne in English. The next question reads as follows.
We must overcome this pandemic faster and prepare for the next crisis. What exactly is PAHO doing to overcome and prepare? Dr. Etienne?
Thank you for this question. As we have said before, the COVID-19 pandemic cast a spotlight on how health, the economy, and social development are intertwined. For health security and development, we need to ensure universal access to health. And COVID-19 has also shown that we need emergency preparedness, a greater capacity to detect and respond rapidly to any risk. And we need to be able to deliver emergency health services at a moment's notice. This, of course, will require the strengthening of essential public health, including surveillance and digitized information systems. The path to recovery from this pandemic, to control sustained transmission, to help people work and live again with mental health and well-being, is through concerted actions, and let me highlight three key areas. First, controlling the spread of COVID-19, including its variants, vaccination at high coverage levels, and adherence to public health measures are extremely important. Secondly, maintaining surge capacity in health systems and services to tackle COVID-19 while addressing other priority health needs. And finally, and very importantly, ensuring equitable access to safe and effective vaccines that are delivered to all. Today, we have healthcare delivery networks that are mainly hospital-centric instead of being people and community-centered. They are focused on resource generation instead of health outcomes, on illness and disease instead of the holistic health and well-being of the individuals. This obviously has to change. To prepare for the next crisis, we need to focus instead on the first level of care, or what we call primary care. And we believe that 70% of health needs of the population can be successfully addressed at that level. And yet, financial investments at that first level of care remains minimal. Certainly, I am convinced that we need increased levels of health financing. We need improved utilization of resources to address inequities, the elimination of out-of-pocket expenditure, and increasing efficiency within our systems. In the same token, we need more investments in health research and to be able to apply scientific evidence in public policy making so that we make decisions that are based on the most current scientific knowledge. Most importantly, we need to build self-sufficiency so we can respond better to future health emergency needs when they occur. Investments in science, technology, and the industrial base in developing countries are essential for the future. And PAHO is working with member states on all of the above, ensuring that we can successfully confront this pandemic and bring it to an end, but at the same time, begin preparation for the future. Not only recovery from COVID-19, but also building stronger health systems, building capacities to address the emergency so that we are better prepared to deliver quality care and to ramp up for emergencies. Let me thank you again and for being with us. And let me remind everyone, please keep safe, get vaccinated immediately as it is offered to you, and please observe the public health measures. Thank you. See you next week.
Muchas gracias, doctora Etienne.
Thank you, Dr. Etienne. Now we have come to the end of this session today. Thank you for joining and for sending your questions. Remember, you can find more information in PAHO's website, www.paho.org/coronavirus, and you can also contact us through email. Thank you for joining in, and please be well and take care of yourselves. Goodbye.